Welcome to British BioMedicine Institute. Today I, Dr. Pramod Khatri, Medical Director, is going to represent a simple topic named as hemoglobinopathies. So basically, hemoglobinopathy is a inherited mutation of a globulin gene which can lead to quantitative and qualitative abnormality of your globin synthesis. So in the structural hemoglobinopathy, there will be the amino acids are basically substituted in the globulin chain, which can result in formation of HbS, sickled hemoglobin. So the sickle cell anemia is basically a homozygous form of a disease in which a patient can inherit the double dose of abnormal gene which can encode for hemoglobin S. Hemoglobin S is a tetramer which composed of 2 alpha chain and 2 beta chain. The beta chain is, however, an abnormal and it consists of valine instead of glutamine at position number 6. The structural formula for sickle cell anemia is HbSS, which is alpha 2 beta 2 6 gluvaline. Glutamine has been replaced by the valine, and the formula alternatively may be written as alpha 2 beta 2 S or sickled, or alpha 2 beta 2 6 valine. The sickle cell anemia basically the sickle cells, they become S-shaped. And in this diagram, it is clear-cut visible that the sickle shape are basically the RBC cells. They have become sickled in shape, and the blue stain here indicates the sickle cell, whereas lower part they are erythroblast, and the small stained are known as Howell jelly body. Now comes the pathology. The hemoglobin S is soluble and it usually causes no problem when properly oxygenated. However, if there is a oxygen tension or oxygen tension decrease, then hemoglobin S, they can polymerize and they can result in formation of fluid polymers. As these polymers realign, they cause characteristic sickled shape in the red blood cell. So in the diagram, we can see that the fibers have become sickled shape, and they have become tectoids. So now comes the factor which affect sickling process. If there is it entirely depends on the degree of oxygenation, the pH level, and dehydration of a subject, and the concentration of other types of hemoglobin. So the pathophysiology consists of if there is a lower pH or decreased oxygen tension and increased sickling, it can lead to increased sickling. And if the viscosity has increased in the slow blood circulation, it can result in hypoxia, which can further promote sickling. All of these lead to hypoxia, painful crisis, and infarction of organs. It should be noted that if there is a presence of HbA and HbF, it can modify the degree and the severity of sickling. Now comes the clinical picture. The symptoms of SCA, sickle cell anemia, can be manifested at the age of 6 months when the level of the circulating HbF falls to the adult level. Usually the condition is characterized by the chronic hemolytic state with jaundice, and relatively constant hemoglobin level will be between 7 to 8 gram per liter G/dl. So now comes the clinical picture. The patients with sickle cell anemia usually manifest or show the following signs and symptoms. There can be joint pain, legs pain, arm and stomach pain. They have a tired, tense nervous system, short trunk, ulcer in legs, thin arms and toward head. And they also have enlarged liver and heart. So the complications of sickle cell disease there can be acute chest syndrome, which is a serious condition caused by the infection or trapped red blood cells in the lungs. Anemia, if there is low red blood cell count. Aplastic crisis, basically there will be a temporary lack of production of RBCs or red blood cells. Bone necrosis, degradation of bone tissue which can lead to hip replacement or other various complications. Hand and foot syndrome, basically there will be pain swelling in the hand and the feet. In the severe infection, there will be a sepsis. It is basically a bloodstream infection. Meningitis, pneumonia can also happen. The risk of infection is usually increased because the spleen is not working properly. And the next disease which can be there, splenic sequestration crisis. The spleen is the organ which filter the blood. If there is a rapid enlargement, then due to entrapment of sickle cells in the spleen, this condition can be life-threatening to the patient. Stroke. Stroke occurs when sickle cell create a blockage within the brain. Sign includes seizure, weakness in the arms and legs, speech problem and loss of consciousness. So basically there are sickle cell traits which are basically heterogeneous forms of the disease, and they represent the combination of HbA and HbS. The structural formula consists of alpha 2, beta 1, 6 and glutamate to valine. Sickle cell trait. Sickle cell trait is a basically heterozygous form of the disease which has been represented as a combination of HbA and HbS. The structured formula is alpha 2, beta 1, beta 6 and 6 glutamine to valine. An individual with HbS trait are usually asymptomatic, but occasional hematuria occurs as a complication of the disorder. So there are various factors which can lead to sickling factor of a blood. So if there is a drastically low pH level, if there is reduced oxygen tension, the conditions are caused if there is a severe respiratory infection in a patient, air travel is unpressurized inside the aircraft, anesthesia, congestive heart failure, and if there is an excessive exercise which can lead to accumulation of lactic acid. All these factors they can promote for the sickling of red blood cells. So the laboratory findings for the sickle cell anemia can be that we can identify through normocytic anemia with hemoglobin level, which can range between 6 to 8, and the peripheral blood can be striking with numerous target cells, fragmented red cells, polychromasia and nucleated red cells, sickle cells which are common basically, and reticulocyte average count will be between 5 to 20, which will reduce during aplastic crisis. If there can also be leukocytosis and thrombocytosis, they are basically common. The bone marrow reflect a mild erythroid hyperplasia during aplastic crisis. So the screening procedures are, we can test with solubility test, These are the special tubes that precipitate abnormal hemoglobin S. The sodium metabisulfite. It is basically an old screening test in which sodium metabisulfite induce sickling. It's important to remember that some trace a rare abnormal HBS also sickle, such as variant of HBC. The definitive test is hemoglobin electrophoresis. The patient with sickle cell anemia produce no beta chain, thus the result will be HBS 80% and HBF will range between 1 to 20%, and there can be increased hemoglobin F value which will lower the severity of the disease. This is seen in basically in newborn babies and in combination of HBS with hereditary persistence of fetal hemoglobin HbFH. Hemoglobin A2 is slightly increased. So now comes sickle cell trait. So a peripheral blood smear is usually normal with exception of target cells. The solubility screening tests are positive and hemoglobin electrophoresis show HbA 60%, HbS 40% and HbA2 usually are increased or elevated. The sickle cell usually are not seen in peripheral blood smear except during crisis. Treatment point. So one of the most important measures in treating sickle cell is to minimize the number of crises by educating the patient or sufferer and their family about the situations which may trigger sickling crisis. They should be advised to avoid sudden cold, dehydration, hypoxic conditions and infections. Hypertransfusion or even exchange transfusions with normal blood can lower the production of hemoglobin S sufficiently in order to reduce greatly the incidence of sickling crisis. This is most important as a short-term measure, for example in pregnancy or before or during major surgery. So this was all about your hemoglobinopathies. I hope you have gained a lot of clinical information through this presentation. Please like, share, comment our YouTube channel. Thank you. Bye-bye.